Hello, my name is Yongxiang Yu. My project title is Fall Prevention Teaching. Let me introduce my clinical site first. My clinical site is a surgical floor in a large hospital. Most of the patients come to this floor is for the joint replacement surgery. They come here for the hip replacement, knee replacement, shoulder replacement. Most of them are the elective surgery. A small part of patients, because they have diabetic complications like abscess or osteomyelitis of the feet, they need IND or amputation. A very small part of patients, because they have the ventricle hernia, they need hernia replacement. Some have the thyroid problem, they need the surgery for the thyroid. That's a very small part of the patients. My learning goal is to teach the high fall risk group of patients to prevent fall, to decrease the inpatient fall rate. I have several learning objectives. First is by finish this clinical, I can quickly identify the fall risk factors for the individual patient. And by finish the clinical, I will tailor the full teaching plan to individual patient according to each patient's condition. And the third one is by finishing the clinical, I will improve my clinical skills and as long as communication skills. How do I accomplish these objectives? And with my preceptor's help, first I use a Baptist fall risk tool to assess each patient. If anyone, their risk score is greater than 12, they will fall to the high fall risk group. That's my teaching target. Another criteria I use is any patient, if they fail within the last month or they have the lower extremity surgery during this hospitalization, they will automatically fall to the high fall risk group. That's also my teaching target. After identifying the high fall risk group patients, I use the fall prevention teaching sheet as my guideline to teach my patients. This is my fall prevention teaching sheet. Usually, I go through every item with them, leave this one at bedside, encourage them to bring it home, put it on the refrigerator as a reminder for them. I also did some literature review about inpatient falls. Literature shows that inpatient fall incidence is very high in the hospital healthcare facility. I also did some research about surgery patients, especially patients under joints replacement surgery. One research found that the overall patient fall rate is around 15 in 1,000 patient days. In the patient group, they have the total knee replacement surgery. Another research reported that among the joint replacement surgery patients, uh, hip replacement patients, they have the high risk of falls leading to severe injury. And the total knee replacement surgery groups of patients, they have the highest fall rates. So compare my patients group. Uh, Most of my patients, they have the joint replacement surgery, either the knee or hip. The knee surgery actually is the most part. Um, Most of the patients, they are very old. They are either in their 60s or 70s. Some patients in their 80s, they still have a knee replacement surgery. So my patient group is, their age is very old. Um, because most of the joint replacement surgery, if they have no complications after the surgery, their hospital stay is very short, usually 3 to 5 days. I even encounter some patients that they have only 2 days hospital stay. The first day had surgery, second day the PT evaluated them, worked with them, then they are discharged in the afternoon. It's very, very short. They have very short time for the learning. So my patient definitely forms to the high fall risk group. Um, After the interacting and watching, observing uh, on the floor, I found that this floor, the best part, every staff have this kind of concept. They have the put the fall prevention in their mind. Almost every patient, they either have the bed alarm on or they either have the chair alarm on. Um, Except their age, their low extremity surgery, and their short hospital stay. My patient also have these characters. Um, after the surgery, they have IV lines, and because of its low extremity surgery, uh, they have a high instant to develop DVT. So every patient has the SCAS, a systemic compression device. And the joint surgery patient, after the surgery, they have drains. Most of them have the ice pad. The ice pad also have lines connected to the cooler. The ice pad can help reduce the pain and reduce the swelling. Um, some even have the oxygen lines. So my patient, they either have 4 lines or 5 lines connected to them. That's a lot of lines. Uh, because of its elective surgery, before they are independent, although they are connected so many lines, sometimes they don't feel or aware it. They want to, they want to do something. They just get up by themselves. Um, there's another, you know, high fall risk factor for this kind of group patient. Um, um, the staff in this floor is so aware of this. That's why they set the bed alarm or chair alarm. Every alarm trigger every steps the phone, so they come here can check the patient to prevent fall. Um, by interacting, assessing, and communicating with this group patients, I learned a lot from this floor, and also not only from my preceptor but also from my patients. Um, First, I found that um, most patients have no this kind of concept about the fall prevention because most of them they have for them is the elective surgery. They have no this kind of concept. Maybe that's why the research reported that Even as a single intervention, patient education may decrease the fall rates. I communicating with the patient. I teach them, explain to them about the hospital environment, explain to them about their bed, why we set the bed low, why the set the side rail up, um, why do we set up the bed alarm. I also explain to them why do they need to wear the red socks, or if they don't wear the red socks, they need to wear shoes. Uh, After my explaining, one day one patient said, "Oh, uh, my wife went to bathroom with barefoot, uh, tripped and uh, get a hip fracture and hospitalized. It's a tragedy." Um, I also explain to patients why they need to call for help even though they are independent before or they want to be dependent. Um, I also explain to them later research shows that toileting related activity is the um, majority part of the falls. Um, that's why we stay with patient when they are toileting. Most patients show that it's the first time they heard about it. They showed understanding. Um, I also leave uh, the teaching sheet at their bedside and some encourage them to take it home, put it on the wall or refrigerator as reminder. Most patients show appreciation um, by interacting, communicating, teaching patients. I found that patient education is the first and very important step to prevent falls. Uh, Only by equipped with this kind of knowledge, patient can participate in the prevention fall prevention actively. Uh, as the researcher pointed out that empowering patients to become active participants in fall prevention during hospitalization could be the answer to prevent patient falls. These are the reference I used. Any questions? Thank you.